This is the injury report presented by NYU Langone Health. The Yankees placed DJ LeMahieu on the 10-day IL on Thursday with a right foot contusion. He's been rehabbing a bone bruise in his foot and will undergo an MRI Friday to check his progress. Well, Dr. Lauren E. Borowski from NYU Langone Sports Medicine Center is here to talk feet. I was just joking. Help us out here, Doc, because there's a lot of people out there, the Twitter warriors, that hear bone bruise, and they're like, oh, you should be out there on opening day. But any pro athlete out there knows that a bone bruise feels 50 times worse than what it sounds like. Can you break down what exactly a bone bruise is, and how would a doctor diagnose that?
So similarly to a bruise in your skin, you can have a lot of bruising in your bone too. The bone is actually a very vascular structure, so you have all these tiny little blood vessels that run in between these canals within the bone, and they can get broken and they can bleed, and they bleed within the bone, and that is what a bone bruise is. But it hurts. It can hurt sometimes even worse than a fracture, and sometimes fractures occur with it. And so that's one of the reasons why it can be so painful. It typically takes a lot longer for a bone bruise to heal than the bruises on our skin.
You said that a fracture could occur with it, and I'm glad you said that because that leads us into the next question. He's been rehabbing this foot, and he even did some light footwork exercises 7 days ago, but he's scheduled to get another MRI on Friday. What exactly are the doctors looking for, and does the fact that they want to put him through another MRI mean something could potentially be going on in that foot other than just the bone bruise?
We don't necessarily always get a repeat MRI, but we do it based on the clinical symptoms most of the time. So if they're not progressing as quickly as we would like, or if they're continuing to have pain or worsening of their pain, that might be another reason to get a repeat imaging. I know he initially got an MRI and I believe a CT scan as well. There are sometimes you can't see a bone bruise on an x-ray, and so we have to get that further advanced imaging to see if there is a lot of edema, which is swelling within the bone. And then sometimes you can have what's called an occult fracture, O-C-C-U-L-T, occult fracture, where we don't see it on the x-ray, but we can see it on the MRI or the CT scan. CT scan is very good at looking at the bone itself. The MRIs are really good at looking at that early edema, but also the soft tissue structures like the ligaments and the muscles too. So the reason that they may be repeating the MRI is to kind of see where that process of the edema is. Is he actually having some healing over the last couple of days, of weeks? That being said, we don't always get the repeat MRI because sometimes people feel better even if they do still have edema there. So even if we do see edema swelling within the bone still, it doesn't mean that it's necessarily going to hold him up that much longer. We don't have to have clearance of that edema to have him get back to where he needs to be. It really is based on clinical symptoms.
Yeah, it's like he's not getting better. He's not progressing. He's not getting back to who he needs to be. And I wanted to ask you, remember, he had an injury on that same foot back in 2022, and that continued to affect him in the last season. So could this be something that could be lingering from back then?
Not necessarily. I mean, this symptom or this injury happened after fouling a ball off of his foot, so it's a pretty obvious direct hit to that area. I believe his last injuries were more of a ligament issue.
Okay.
But what could happen is that when you have an injury and you are off of that foot or you are not utilizing it in the way that you normally do, you can start to get weakness. You can start to get some issues with stability in that joint, in that foot, and so maybe that's something that could be lingering. And now that he's been off of it a little bit more, he needs to start working back on getting that strength and stabilization back in the foot.
Well, I was going to ask.
I'm actually very interested in feet, and I think the feet are very neglected in terms of strength training. Actually, I work with a lot of dancers, and so I talk a lot about strength in the feet.
Well, that leads us into the next question. How does an athlete go about healing from this kind of injury, especially in the foot? And is this something that you worry could reoccur again throughout the season?
So first and foremost, it's taking pressure off of that area for a while. It really is pressing on a bruise, right? So if you're constantly putting pressure on it, you are just continuously, poking the bear. You're putting more pressure on it. And so you really have to take some of the weight off of it, take some of the pressure off of it, and work on the musculature without that weight-bearing portion. And then as he starts to feel better, he could start to add more weight to it, add more impact to it. So I certainly wouldn't want him running necessarily, off the bat on a bruised foot. And so we slowly start to incorporate those higher impact activities, running, jumping, as he starts to feel better from the bone bruise.
Do you think he's still in a boot? The fact that he has to go get another MRI on Friday, does that kind of mean that he could possibly be in a boot to keep that weight off that foot?
Yeah, I think that, it's protecting it, right? So you're further protecting and kind of dissipating the forces, kind of spreading out that force a little bit more throughout the foot instead of constantly through that same area again and again. So the boot is protective. I'm sure they have him out of the boot working those muscles when he's not having to be walking around. I think the boot isn't necessarily a bad thing.
Here's the question every Yankee fan has been waiting for me to ask. If the second MRI comes back clean, when can he return to the lineup?
So this is hard. So it's how he feels, right? So as I was saying earlier, we get the imaging, but the imaging is never the be-all, end-all. We have to see how the patient is actually feeling, how the athlete is actually feeling. So it really just depends on how his strength and his stability and how much pain there is as he's putting weight through it. So I think a clean MRI with no edema would be great, but it's going to depend on just how he's feeling. And I know that sounds very arbitrary and subjective, but I think that he's got all the best people behind him working with him to strengthen up that foot. And it's better to treat it now so that it doesn't linger, right? So that's the problem, is that we don't want this to go further into the season. So let's give him the rest he needs now rather than continuously poking that bruise.
But Doc, when you say things like depends on how he feels, when you say that to me as a former professional athlete, I'm going to want to play. I'm going to tell that training staff that, hey, I'm good. I can get out there, especially with it being the beginning of a new season. So you think the Yankees training staff has to protect the player from himself in this situation?
Absolutely. Absolutely. All professional athletes typically have that same attitude, right? So it is better. I think we have to just reiterate again and again, like, let's take care of this now so you are not dealing with it come May, June, July. We want to make sure he's healthy to play the majority of the season. He may miss a few games in the beginning, but, let's take care of it now so it's not continuing to linger and be a problem. And really, when it comes to a lot of injuries, it's not just about can he go out and play, but it's can he go out and play his best, right? We want to have them perform at their highest ability. So we need to get them back to their peak condition before they should be able to go back out.
Doc, I don't know too many people out there that can make talking about feet sound so cool. You are truly one of one. Thanks for hopping on with us.
Thank you so much for having me. Appreciate it.